Hello friends, you're welcome to my YouTube page. Today I'm going to be talking about anti-inflammatory diet and lifestyle for people managing joint pains during menopause. Okay? Joint pains is inevitable. It happens. It comes during menopause. A lot of women experience it and they don't really know that menopause is one of the things that is causing this joint pains. Like I've been saying in my previous videos, menopause comes with its own symptoms. It comes with its own challenges. All right. But before I continue, let me quickly introduce myself. My name is Anne Oviero, and this is Healthy Aging with Annie, where I talk about health challenges faced by mostly women. Okay, so if you're just coming to my page, do not forget to subscribe and also follow my page on Facebook, Healthy Aging with Annie, and on Instagram, Healthy Aging with Annie. Kindly share any of my videos whenever you come across it. Always, you're free to always comment and then like my page and subscribe to my page. Thank you very much. So inflammation is a natural process that helps your body to heal and defend itself from harm. However, inflammation is harmful when it becomes chronic, and a lot of women experience this inflammation during menopause. Chronic inflammation can last for weeks, for months, and even years, and this can lead to serious health problems. Now, having said that, what are those ways that you can help yourself to reduce this inflammation and also improve your overall well-being? Inflammation comes in different ways. A lot of women experience it in different ways, most especially when it has to do with the aging process and then menopause. A lot of women experience this, a lot. So that's why you need to take note of every details in your body. Now, what can actually cause this inflammation? There are certain lifestyle factors that can cause it. Like I said, um your habitual life factors can cause it. It can promote inflammation, and then aging and menopause can also trigger pains, can trigger this inflammation. And also, when you consume high amounts of sugar, high amount of fructose, corn syrup is particularly harmful, and this can also lead to insulin resistance, diabetes, and also obesity. So you need to help yourself to watch what you eat. I like talking about this food, what you eat, because it is what you eat that can either make you or destroy you. That is why you need to manage yourself, especially during this transition stage. It is very, very important. A lot of people use vegetable oils that are processed, and you cannot get that health benefit that you want from it. There are some vegetable oils that you also need to do away with at this transition stage, because you need a healthier diet to help your body fight those joint pains, fight those inflammation, fight all those symptoms related to menopause and the aging process. Now, excessive intake of alcohol too can also trigger this inflammation, and also processed meat can also trigger this inflammation in your system. Additionally, your lifestyle, inactive lifestyle can also contribute. Sedentary lifestyle can also contribute. Eating unhealthy food, drinking alcohol or sugary beverages, and getting little physical activities are also associated to increase this inflammation in your body, especially if you're now in that transition stage, menopause. So what exactly is the role of your diet if you're going through these pains and menopause symptoms? If you want to reduce inflammation, you need to eat fewer inflammatory foods and more anti-inflammatory food. It's very, very important to take note of that. You need to base your diet on whole grains, whole nutrient dense foods that contain antioxidant, and avoid processed products that can trigger these symptoms, because antioxidants work by reducing the levels of these free radicals, and this helps your body a great deal, because it helps your body to boost your metabolism as well, and also help to fight that inflammation and put it on check. Okay, now your anti-inflammatory diet should also provide a healthy balance of protein, carbs, complex carbs to be precise, and also fats at each meal. Like I said, you can always add omega-3 fatty acid to your diet. It's very, very important and very good. Make sure you also meet your body's needs for vitamins, minerals, fiber, and water. So one diet is considered anti-inflammatory, and that is the Mediterranean diet. I've talked about this Mediterranean diet. It's very, very good. This Mediterranean diet has been shown to reduce inflammatory markers and is super, super good. A low carb diet also reduces joint pains, inflammation, particularly for people who are obese, people who are experiencing menopause symptoms, or people who have this metabolic syndrome. So try as best as possible. Also, vegetarian diet are also linked to reduce inflammation. So you need to choose a balanced diet that cuts out processed foods, boost your intake of whole grains, and then anti-inflammatory, antioxidant rich foods. So now, what are those foods that you need to avoid? Some foods are associated with an increased risk of chronic inflammation. So but if you can try and consider cutting off or minimizing these foods that I'm going to mention, that means you're already treading on the right path. Beverages, sugary beverages, sugar sweetened drinks and fruit juices, try and cut it off. Refined carbs like white bread, you can go for wheat bread, and then white pasta, white rice, you can go for brown rice or our local rice or fada rice with lots of vegetables. They are very, very good. Then desserts like cookies, candy, ice cream, cakes, you need to minimize or cut it off. Then processed meat like hot dog, sausages, you need to also cut it off. Processed snacks like crackers, chips, you need to cut it off. Then there are certain oil that you also need to cut off from your diet. Processed seed and vegetable oils like soybeans and corn oil. Okay, trans fat, you need to also cut it off from your diet if you want to enjoy this transition stage, this menopause stage, and avoid pains. You need to cut off this food from your diet. Also, excessive alcohol, you need to cut it off from your diet. So avoid or minimize sugary foods and beverages. Processed food, you need to avoid it. Excessive alcohol, refined carbs, and unhealthy fat, you need to avoid it. Now let us quickly look at these topmost 5 topmost anti-inflammatory foods that you should add to your diet if you're managing menopause and joint pains. Include these anti-inflammatory foods to your diet. Let it be consistent, and you'll be glad you did. Once again, do not forget to subscribe to my YouTube channel, and also share my videos and follow us on Facebook and Instagram. Vegetables. Now, broccoli, kale, Brussels sprout, cabbage and cauliflower, ugu leaves. We have a lot of leafy green vegetables. Add it to your diet. These are very, very good. Fruits, especially deeply colored berries like grapes and cherries, they are very very good. They are very high in antioxidant, and they are very good because they fight these pains, these joint pains, this inflammation. They fight it a whole lot. Then high fat fruits like avocados and olives, they are very good because they contain omega 3 fatty acids. Like, I use this a lot anytime I miss my avocado. It contains omega 3 fatty acid, and it's super super good. That is why I love using it. You can see it's almost finished. I use it a great deal. It's very very good. If you want to know how to get it, you can just call me on 08034005928. Then also fatty fish is also very good, like salmon fish, sardine fish, tuna fish, mackerel fish. We have a whole lot of fatty fish that you can add to your diet. Is super super good. Then nuts, I mentioned more than five. Nuts like almond nuts, walnuts, cashew nut. We have a lot of nut, Brazil nut, that you can always add to your diet. They are also very good and rich in this omega 3 fatty acid. Then peppers, we have bell peppers and chili peppers. But then there are some women that hot pepper, this spicy food, can trigger their symptoms. So if you eat hot pepper and you notice that it triggers your hot flash, then you need to remove it from your diet, or put little quantity whenever you want to eat it. Then dark chocolate is also very good. Then spices, I've mentioned this: turmeric, cinnamon, garlic, they are also very good. Then your green tea is very good. Like, I like taking my aloe blossom tea. It's super good because my aloe blossom tea contains clove, cinnamon, orange peel, garlic, ginger and turmeric. So that is why I love taking my aloe blossom tea. It's super super good for me. It's natural, and it helps to relieve me of joint pains, calms my nerves, and help me to sleep well. For women experiencing insomnia, you can always go for this aloe blossom tea. It helps you to calm your nerve and sleep very well. Then you can also take a bit of red wine. Is also very good. So it's best that you consume a nutrient dense whole food that can help to reduce this inflammation. Then there are other helpful tips that you can add to this diet that I just talked about. Supplementation is very very good. It can help you to reduce inflammation. Any supplement like this that includes fish oil and curcumin. Now my curcumin, this is it. This forever move contains turmeric, and you know one of the ingredients in that turmeric is curcumin. So it's very very good. It helps to take care of joint pains, and that's why I don't joke with this. And it's also very good. The fish oil is very good for the cardiovascular heart and inflammation. Regular exercises are also very important. Try to do exercises because they help to decrease inflammatory markers and also decrease your risk of a chronic disease. Then try to get enough sleep. It's very important that you try to sleep well. Is very very important because getting enough sleep will help you, relieve you of stress, and also reduce that inflammation. So you can try to boost the benefit of your anti-inflammatory diet by taking supplements and making sure that you get enough sleep and exercise. So try as best as possible, because the reward of an improved lifestyle is that an anti-inflammatory diet along with exercise and good sleep can help you with the following benefit. There will be improvement. It will relieve you of your health, overall health. It will relieve you of joint pains. It will relieve you of that inflammatory bowel syndrome. It will relieve you of this lupus arthritis. It will relieve you of an autoimmune disorder, and also there is a decreased risk of obesity, of heart disease, of diabetes, of depression, of cancer and any other diseases. That is the reward of an improved lifestyle. Now, it will also reduce the reduction of inflammatory markers in your blood. Okay, and it can also better your blood sugar, it can better your cholesterol levels, and also improve your energy and your mood. A lot of women have this mood swing, anxiety, the mood swing. They can snap at anybody, shout at anybody at any time. It is because of that symptom that they are experiencing as a result of the menopause, and also that inflammatory markers. So try as best as possible to follow an anti-inflammatory diet and a lifestyle, because this can help to improve on your overall being and reduce your risk of um any kind of diseases. The summary of everything I've just said here today is that chronic inflammation is unhealthy and it can lead to disease. And in many cases, your diet and your lifestyle drives inflammation or makes it worse. And you should also aim at anti-inflammatory foods for optimal health and well-being, because this will help to lower your risk of disease and improve your quality lifestyle. So try as best as possible to put all this into practice, and then you'll be glad that you did. Thank you very much. Do not forget to subscribe to my YouTube channel. Do not forget to share my videos. Follow us on Facebook and Instagram. And then thank you once again. See you again in my next video. Bye.